Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Leukoplakia. So this is more common in the oral cavity. They're characterized by a white patch, and this white patch, it cannot be rubbed off. So the risk factors of leukoplakia, it includes smoking, alcohol, as well as the ill-fitting dentures and the jagged tooth. Now, what are the key pathological features of the leukoplakia? Leukoplakia, it includes the hyperkeratosis and also the acanthosis. So what is the diagnosis? The diagnosis, if you see, it will be it requires a biopsy for confirming the diagnosis. Now, how to manage this leukoplakia? So the management of the leukoplakia will be by stopping alcohol. So you stop the alcohol as well as the tobacco intake. Then you treat the underlying cause. You treat the underlying cause, as well as there is a surgical excision for cases with moderate to severe dysplasia. So in case of moderate to severe, you do a surgical excision. To learn and grow daily like this, please do subscribe.